Hi, my name is Destiny. I'm a trainer here at Glownar, and today we are going to be discussing everything you need to know about radio frequency. Stay tuned. So when discussing radio frequency, it is known as a skin tightening treatment. What it does is it uses heat to stimulate collagen production. The science behind radio frequency is we want to get the skin at least to 42 degrees Celsius or 107.6 degrees Fahrenheit, of course, without burning our client. In order to achieve that skin's temperature, we need to make sure we're always using our conductive or ultrasound gel, and you will be needing an infrared temperature thermometer gun. So if you purchase any of our machines that have radio frequency, these handpieces may seem familiar to you. These are all radio frequency handpieces, and they all have the same protocol. If you have any of our large machines, this is what your radio frequency screen will look like. This applies to our face radio frequency and body radio frequency. Beginning radio frequency, we always want to make sure that we're at least starting out with 50% energy. We have two modes. We have a normal mode and we have a pro mode. Normal mode simply means that probe is always on. It's always hot and it's heating to the amount of energy that you put into the machine. Pro mode only means that that probe is only going to turn on skin contact. It will turn off when you take it off of skin contact. You may notice this light bulb on your screen. It controls the red LED therapy inside of your handpiece. If you have a photosensitive client, a client with any type of light sensitivity, all you have to do is turn that light bulb off. That red LED therapy will not transmit through your probe. You will still have heat and you will still have energy. If you have any of our smaller devices, this is how your radio frequency screen will look. This also applies for the face and the eye. You will be following the same radio frequency protocol. You're just going to increase to 50%, and you're going to always start on pro mode. Doing radio frequency, we recommend that you divide the face into three, starting at the forehead, and you're going to apply a nice amount of conductive or ultrasound gel. We recommend that you do nice tight circular motions for about 15 to 20 seconds to heat up the area. Then you're going to go ahead and you're going to check your temperature. We need to see how close we are to that 42 degrees Celsius or 107.6 degrees Fahrenheit. Once you have heated up the area and we're closely getting to our temperature, all we're doing is moving on to the next area and doing the same thing we did the first time. We need to make sure that we come up with our formula of figuring out how long we need to keep the probe on the skin doing this nice circular motion to get it to the temperature. Then you can use that same amount of gel and apply it to the next area, which will be the cheek area, and you're just going to repeat the same protocol. We're applying that probe to the skin, heating up that area, and then we're going to go ahead and we're going to check our temperature and see how close we are to the degree that we need to be. You're going to complete this step all over the face until the treatment is completed, and then you have completed your radio frequency treatment. Keep in mind, this is a skin tightening treatment and we are using heat, so we always want to be mindful of our client's comfort level. Now we're going to answer the most frequently asked questions regarding radio frequency. Do you recommend radio frequency before or after hydrodermabrasion or dermaplaning? Radio frequency should always be done after your exfoliation step in your facial. What part of the body can radio frequency be done on? Radio frequency can be done on any part of the body except the thyroid and the eyelid. How long does the radio frequency treatment take, and is the temperature the same for all of our radio frequency handpieces? Radio frequency can typically take anywhere between 20 to 30 minutes depending on the skin density. And as for the temperature is always the same in all of our devices, but it can also be controlled depending on your client's comfort. What is the difference between normal mode and pro mode? Normal mode simply means that the handpiece is always on and it's always hot. Pro mode means that handpiece is only going to turn on skin contact, and it's going to turn off when you take it off of skin contact. So which one is better? Pro mode. We recommend pro mode starting out for you to figure out the formula of how long you have to keep the probe on the skin. Then, once you have figured out and you verify twice with your infrared temperature gun, you're going to go ahead and switch to normal mode. How many times can radiofrequency be done on a client? Radiofrequency should only be done once a week. If you have eye radiofrequency, if you have face or body, all treatments should be done in the same day. If it is scheduled for later on during the week, you're going to have to reschedule the treatment to the following week. If you have a client with any Botox or fillers, if they want to see you before they receive their treatment, they can see you within 48 hours. If they want to see you after the treatment, minimum wait time is going to be 4 weeks. So that's going to be all for radiofrequency today. If you have any further questions, please feel free to subscribe and comment below. Don't forget, all of our machines come with in-depth training where we go over protocols, pricing, contraindications, and maintenance. Thank you all for watching.